invitation shortly after I arrived in Gaza. So just a quick question, can you guys see the screen?
Yes.
Yes, okay, perfect. And I don't have any conflicts of interest to declare. And I wanted to start talking a little bit about the title of this presentation, Laughter is the Best Medicine, Happiness in Palestinian Healthcare Work is at War. Because some of you might have seen that the original article title was Attacks on Healthcare Facilities in Gaza. But yesterday I received this email from the conference organizers basically saying that, we don't want to hear who injured people, and threatening that, if we broke any of these rules, that there would be the right to end or interrupt the session. And of course, I noted that the American Association of Emergency Medicine was very quick to identify Russians as being the source of hostilities and the invasion in Ukraine. However, have made no statements about Palestine and are in fact censoring people not who wish to talk, including by threatening my career. And I don't want that, so we're just going to keep it very light. There's no sense talking about anything heavy here. We're all here to have fun, so let's have fun. And there will be some things, sometimes there may be some unhappy truths around us, but we're just going to ignore them. Everything is fine. And Palestinian healthcare workers are fine, so we're just going to talk about that. Look at this happy doctor. Her name is Rezin. She is happy, such a pleasant person, wonderful woman. This is one of my friends, Marwan. You can see by their smiles just how happy they are. Where is it that these Palestinians find happiness? This is Ala, a nurse, very happy. And one of my good friends, Dina, she's a public health worker, very happy. And Hani, oh my goodness, Hani is such a wonderful, wonderful man, emergency physician. Just a smile of gold. Where does he rank it? And I think it's really important to talk about happiness and how it is that Palestinians get it. Because it's important to be happy. It's important to talk about the resilience and everything like that. We heard some comments about how we have to approach this and how we have to make it. So let's talk about some of the things that Palestinian doctors do to maintain their happiness and their high spirits, and some of the barriers. Of course, Palestinians are strong people, they are capable people, and they have been doing an amazing job in their hospitals. And so when maybe some people from the outside might look at this photo and see an ambulance that got destroyed, and we can't say by who because I want to maintain my career, the Palestinians just smile and make sure that everybody is happy. And that's how we have to keep it. This might look to most people like it's destroyed medical machinery that was raised during an attack on a hospital that was supported by approximately several hundred Israeli doctors who signed a letter. And that's what it is. But, I mean, let's just try not to think too much about that. These are incubators, but the key, as was mentioned, these incubators do not have Geneva rights protections. These protections were taken away from them because they belong to Palestinians. And this is a hospital that was burned down. This is actually, in my view, outside of Nasser Hospital. As you can see in the bottom left there, there's another ambulance graveyard separate from that other ambulance. Kind of funny, sometimes multiple ambulances get destroyed in attacks by, we're not going to say who, because we don't want to talk about who does things. However, there's also a kidney dialysis department, which I guess was probably also a Hamas, and so it had to be destroyed. But the Palestinians just kind of laugh because, that's what we do, since we can't talk about anything else without risking getting censored and having our talks stopped. And so what are some barriers to healthcare worker happiness among Palestinians? Well, the murder of healthcare workers is a huge barrier. Again, who murders them? I don't know. We can't say. But a lot of them get murdered. 1,400 medical workers have been murdered in Palestine by Can't say. And of course, their families also get murdered. Again, by the who knows who, somebody murdering the families of Palestinian workers everywhere. And of course, it's a bit of a barrier to happiness and staying happy when there's genocide and ethnic cleansing all around you and more crimes. But again, we're just going to keep this light. I'm going to keep this very light because if we talk about any of that stuff, then we're going to get censored by the American Association of Emergency Medicine and the organizers of this conference. So nobody's responsible. Nobody's at fault here. Everybody is just trying to communicate and keep things light. What are some barriers to that's why we're all here today. What are some barriers to medical system harmony? Well, the medical system right now in Gaza is at some disharmony. There's a lot of expert disagreement on why, but I have some theories that some of my colleagues believe are the cause of some of the disharmony in the medical system. The destruction of every hospital. Partial, I mean, it's true, some of them are only partial. There are 3 that are only partially destroyed. The other 33 pretty much completely destroyed. That makes it very hard to maintain harmony in the medical system. The complete siege on all medical equipment. You know, I would really love to use tourniquets on my patients, like the speaker before me. Not really an option because that speaker's army has completely besieged our entire region and does not allow any medical equipment in. And that leads to some disharmony. And of course, there's a famine that causes severe malnutrition in patients. So even when I do receive patients and have some equipment to treat them, I'm faced by the fact that they have no access to protein, no ability to heal, no ability to do hardly anything. There was a lot of call for us to collaborate with our Israeli colleagues, but I was disappointed that so many of them signed a letter asking for Shifa Hospital to be destroyed and justifying it on all kinds of grounds. You know, some people might say that this makes them not just complicit, but active members of this genocide. But I don't think that we should really dwell on whether doctors think other hospitals should be destroyed or not. I mean, after all, we're all doctors. We all just have to get along and collaborate, right? So I think the most important thing here is that we maintain our desire and ability to be happy. We can't discuss any of the real issues here because they wouldn't make us happy if we have to talk about dead children. I mean, that makes me cry. Every time I see a dead kid, I cry pretty much anymore. Sometimes I just cry, I don't know why while I'm working because I'm so traumatized. But I still try to stay happy. Just like these 5 close friends of mine, all of whom are dead. Killed by? Can't say, but I'll tell you, spoiler alert, it was Israel and their genocidal army.
Dr. Loubani, do you have anything to teach us here today? Dr. Loubani, do you have anything to teach us here today?
Are still helping with the genocide. Genocide and Holocaust, this should not be controversial.